leaving. I end on time. You'll be out the door. And I appreciate you being here. My name's Jan Knickerbocker, for those who haven't met you. And I am a nurse background, critical care, ER, and for more than 30 years, because I started in the 70s. And then I became a wife to the fellow with the gray beard, and then I had 2 kids. And this is in Colorado. I hail from New York, the Knickerbocker name, and right now I work for the Studer Group. I left my little hospital where all my experience was, a little bit bigger than Grand View, but certainly small, under 100 beds. And we relocated to the Syracuse area in more central New York. So the reason I'm here today is that the leadership wanted me to come and talk to you about how you all fit into the organization, where the organization is going, and what you can do that's pretty simple and basic to improve and show as a glowing star the organization that Grand View is. We always start with our own mission and vision. This is the Studer Group's mission, is to really make healthcare better for employees to work, for physicians to practice, and for patients to receive care. And our vision is to be that intellectual capital for the leaders. So to provide them with studies, with research, with what we know are best practices, evidence-based tools, all of that is an intellectual resource. This is a healthcare flywheel. I think it was stolen from another person and kind of modified by our boss. But at the heart of it is this purpose and worthwhile work of making a difference. And my brother, I'll just let you know, my brother retired from the Air Force probably about a year ago. And he took a job, because he wasn't ready to quit work, he took a job in the maintenance department at the Glens Falls Hospital in New York. And he worked night shift. And so he had been in the job about 3 months, and I said to him, how do you like the job? And he says, I love it. He had a big old smile. And I said, well, he says, well, let me just tell you the simplest thing. I get a call, I go up on the unit, I unplug that plug toilet, the patient loves me, the staff loves me, and I walk away feeling like I made a difference. Simple, simple. So when you think about that, then you know that you have the courage to move forward. My brother felt a little self-confident. And so then he applied some items that he knew worked in the way that he could communicate with others, other teammates, called execution of certain tactics. And because of that, then he's absolutely feeling like he's winning. He's doing a great job, he's got a good team around him, and he has a good team that he works with. And so when you go back and you're feeling that winning, it takes you right back to worthwhile work. And being in healthcare is worthwhile work. And that is the why. So, you know, for me, when you know that you have a human responsibility, something that is a best practice, that if you do it, it will help you achieve your outcomes, then you need to just apply it and do it with urgency. That's it. An example of that might be, the research showed many years ago that if you took a little baby aspirin when you thought you were having a heart attack, that it delayed damage to the heart muscle. So quickly, rescue squads, ERs, in your own home, you found people stocking little bottles of baby aspirin and finding that they were taking it. And now it's just a standard of care, it's expected, and everybody should do it immediately when they think they're having a heart attack. This slide, I kind of wrote those values over there. We're going to kind of reference them throughout this, because each one of you here has a reason to do the things that you're being asked to do. And it might be one of these topics. So I won't try to keep toggling back and forth. Here's your mission statement. And I really love this. I'm just going to pull a couple of words out. What is exceptional health care? I mean, exceptional health care. Not good health care. Not very good health care. But the bar is high. Exceptional health care. Today and tomorrow. Customer focused. Okay. Fiscally responsible. When you think about the patients and the patient customers, the first one that you think about, when they come into a hospital, they're just plain afraid. Even if they're coming in for a normal test, say a chest x-ray, and they're coming in for a chest x-ray and we're thinking, we're registering, oh, you know, it's just a chest x-ray. And you're the tech and it's like, oh, simple chest x-ray. The patient, scared to death. What's the result? What might happen? Is my privacy going to be invaded? Are they going to treat me and not mismanage my record? They're afraid of everything, and they're afraid of you. So when you think about what the needs are and that extraordinary, exceptional service, that means you have to go the extra degree. You have to step it up. Very good isn't enough. And you can't do it sometimes. You can't do it usually. Well, usually I'm pretty good. It has to be always, every time, every patient. And you need to leave every patient feeling good about the choice they made to come here. Okay? And making them feel special. When you have somebody that you're meeting in the hallway, to smile. Smile at. When you're in the elevator, to say hello. Make them feel like they're coming into your house and you're welcoming them. How many have negativity in their workplace? Okay. Negativity. I'll tell you, I've seen 130 people and almost all of them have raised their hands. So you need to own what you own and what you bring to the workplace. Okay? Don't be a renter. And when you sit back and you think about how to eliminate the negative thinking, we're going to talk about that. You should be infinitely grateful. Grateful for a job, grateful for an opportunity to make an impact, grateful to get up and have meaningful work every day. Okay? Purposeful work. And when you think about the golden rule, I think it was do unto others as you would have them do unto you. Let's flip it around and make it, for this purpose, do unto others as they would have you do unto them. So you think about a patient and what my husband would want in healthcare and what I would want in healthcare. Two different things. Two different things. What your dad might want in a hospital, what your mom would expect. Two different things. So you have to think of the individual and not be lumping them all together with an assumption. Renter behavior. Love this. Renter. They don't own it, do they? Here's another example. You see that? Don't you love it? That's not my job. I'm not picking up that paper. I'm not going to empty that. Just going to go around it or over it. Keep walking over it. Was in a restaurant in the Chicago airport. And my waitress had walked by after she took my order and realized she hadn't put any silverware on my plate. So I could see her. She had a tray in her hand and she reached over and got silverware and some napkins. And a few napkins fell on the floor. And she put them on my table and went on. Now, she didn't pick them up. And not only did she not pick them up, neither did 4 people who walked by, walked over, walked around, that were employees. Nobody picked them up, okay? Until the person who was seating patients went and started coming up the aisle with the napkins under her foot. All right, just to think about. Love this. How about this one? Now, obviously, the caution cone was there, but they didn't see that there was indeed more water. So don't do your job halfway. Make sure that it's absolutely the way you'd want it in your home. Hardwood floors. Here's a really good example of an owner, not a renter. This is a housekeeper at one of the hospitals that we coach. Now, this housekeeper is really cute. She was told she had to do AIDA when she went in the patient room, and she has very bad hearing disability from the time she was little, and as a result has a speech impediment, and I have to do AIDA. So she figured out a way. On the other side of that little paper she's holding up is her introduction. I'm going to clean your room. It'll take about 15 minutes. And when she gets ready to leave, she turns it around and ends with this. She found her way to do aided. Aided's an expectation, and people should be very fluent with using it always. Ownership. We're not going to talk about the renters. But ownership, like in your home, you see it, you do it, you just take care of it. Escorting patients or families or people who appear lost to where they need to go. Keeping your work environment clean and tidy. Assisting your coworkers. It's all part of ownership. Greeting others with eye contact and a warm smile. Warm smile. And apologize if expectations are not met. Is there a service recovery program here? I think it was started or in the planning stages. Right. And so when you think about a service recovery program, it's not placing blame, and it's not even accepting blame. It's just acknowledging that expectations weren't met. That's it. We didn't meet your expectations. Let me see if I can help you. Done. So the role model of the behaviors isn't always, and that's how you can impact the organization. With a warm smile, eye-to-eye contact, walk them, and be comfortable doing it. Now, this victim thinking, I kind of renamed whining into victim thinking, okay? And you really need to think positively. Those of you who are going home, you're going to go home. You're going to go home on time. And those of you that are coming in, you're going to have a great shift. And you've got a good team that you work with, and you can be positive. And you can really control your own destiny. You can control your own mindset on how your day's going to go. If you don't participate in gossip and rumors, that'll keep you happy. Because if somebody's gossiping about another person, they're gossiping about you. And you should call out that negative behavior. If you hear somebody gossiping, just say, Sue's not here to defend herself. I wish you'd stop, and leave. Just be done with it. So if you are trustworthy and you have a high level of integrity, the workplace will go easier. And if it doesn't start with you, then who would start it? Who would start it? Okay? And if it isn't now, then when? When would it happen? I don't know. It has to be role modeled. So, kind of talked a little bit about values, a little bit about skill with data. I'm going to talk about recognition. Anybody in the room received a thank you note in the last 3 months, 4 months? Love it. Recognition. A lot of ways to recognize. And my challenge is that when you leave here, you come to work tomorrow, to think about 3 people that you could recognize. And to be specific, what is it that you want to let them know about? Now, if you've got a negative person you're working with, it may be that they've got great shoes on, and you like their shoes and you compliment their shoes. Something little. Doesn't have to be big, but it should be specific. And share at least one win when you're having your department meetings, your little huddles before you start your shift. Talk about that recognition. Talk about what made your day the last day you worked. Be positive. Start out on the positive. And share that. Now, do you think somebody could get too many compliments? Question. Do you think they could? Too many compliments? Never. Never. At least 3 to 1. To change the behavior. Think of that negative person that you're trying to, I got to work with her or him and I've got to make it better. 3 to 1. My boss says maybe even 5 to 1. Okay? It won't get tired. Anybody know what we they is? No?
Sounds like blaming.
It's when you position yourself above others. I wouldn't do that, what they did. I would get you a blanket, but laundry just isn't on their game. We don't have any linen today. I'm sorry your food is cold, but food service is just not doing their job.